So I'm Dr. Jim Del Rosso, the editor-in-chief of the Journal of Clinical and Aesthetic Dermatology. I like to say affectionately referred to as JCAD, or the Green Journal. It's picked up that name over the years. And I'm here in Austin with our very talented managing editor, Julia Eckert. She does a great job. I couldn't do this without her and other members of the team at JCAD. So this is JCAD Dialogues and Reviews, and it's a commitment on my part as the editor-in-chief to try to bring you what I think is important new information and observations. The first is actually a new therapy that is FDA approved, an oral treatment for rosacea, patients presenting with papules and pustules, and obviously the perilesional erythema that goes along with that. And for the first time, we now have an oral minocycline that is approved by the FDA for adults with inflammatory lesions. That's papules and pustules, maybe a few nodules, but not many, primarily papules and pustules of rosacea, and certainly they have erythema surrounding those papules and pustules. This is a specific formulation. It's a low-dose minocycline in a modified extended release formulation that has 40 milligrams of minocycline. It's different than the other FDA-approved extended release minocyclines that are approved for acne vulgaris. So it's a totally different formulation. And to make a long story short, there were studies that were completed. The first one in phase 2 showed that this low-dose minocycline formulation actually gave superior results than the modified release doxycycline, the 40 milligram once a day, which was initially approved as Rosacea and does have some equivalent generic formulations, was superior in terms of lesion reductions and evaluating investigator global assessment in phase 2. So they went on to phase 3, and myself, Neil Bacci, he's the lead author on the article, I'm the second author, and others, and also investigators studied this in the 2 phase 3 studies in adults with rosacea, with papules and pustules. And what we saw was there was superiority of the low-dose minocycline to the placebo group, both once a day over 16 weeks. They also showed superiority to the placebo in terms of lesion reductions. But included in that study, and there were over 600 patients in both studies. Included in that study was also the comparison to the modified release doxycycline 40 milligrams once a day. And the low-dose minocycline proved to be superior in terms of investigator global assessment, getting patients to clear or almost clear with at least a 2-grade improvement, and in the inflammatory lesion reductions as compared to the modified release doxycycline. We know that these tetracycline agents have anti-inflammatory activity. Minocycline happens to be pretty lipophilic, so it's able to get into skin in high concentrations, and we believe that anti-inflammatory effect is helpful with minocycline. So we now have another approved oral treatment as an option to use for patients with papulopustular rosacea. Separately, in the IGA, they did not include erythema assessment, which is something that's been happening more recently, which is actually very smart, because it clouds the evaluation when you're really trying to evaluate the response of papulopustular rosacea. Because you can have erythema that's related to dilated vasculature that sits behind, that makes it hard for the investigator to evaluate when you're looking really primarily at the inflammatory lesions. They did a clinician erythema assessment separately, and they showed that the low-dose doxycycline was superior to the placebo in reducing that erythema, and that's primarily going to be that perilesional erythema. So as those lesions go down, that erythema, which can be pretty prominent, also improves. So this is a nice addition to the armamentarium. The safety evaluation, really the only things that came up in at least 1% of the subjects was nasopharyngitis, which is very common in studies because patients get runny noses or upper respiratory infections or throughout the year. And that was the same in the placebo group, the low-dose minocycline group, and the modified release doxycycline group. And also, these studies were done while COVID was around, and some patients developed COVID, but it didn't appear to be any greater potential in any of those groups. So it didn't seem to be related to any of the study medications. So I think that will help you as another choice that we have that's FDA approved for rosacea.